Hi there, I'm Courtney, a reporter at the Salt Lake Tribune, and this is Trib Talk. Today we're going to be talking about Utah schools opening back up in the fall amid concerns of the coronavirus. I'm joined by Sydnee Dickson, the State Superintendent of Public K-12 Schools, and Geoffrey Landward, the General Counsel for the Utah System of Higher Education. Welcome to both of you.
Thank you. Thanks for having us.
Thank you. Thank you very much.
Let's kind of start off with the basics. What factored into the plans to reopen both schools and colleges, and what will that look like for classrooms? Sydnee, maybe let's start with you.
It's very virus dependent, and so we're always trying to predict and get out ahead of it. And in doing so, we are looking at 3 different scenarios. So much like if we were in the red or high risk zone, or even the orange with moderate risk, then we would continue in remote learning. And we definitely learned some lessons, so we would revamp and revise a little bit, but that's one possibility. The other possibility is a blended model, which would be in that yellow risk, and then face-to-face would be in the green risk zone. So our schools really have to prepare for all 3 of those scenarios, and we're hyper-focused right now on what a blended model might look like, because that takes into consideration things like spacing in classrooms and hygiene that's really modified. So there are a lot of variables in that space that our schools are looking to. Those are the 3 areas that we're focused on.
Perfect. And yeah, Jeff, what is it going to look like for college campuses?
Well, this is an incredibly complex problem that we're trying to solve. With college campuses, especially, we're really dealing with essentially small cities. I mean, there are so many components to our campuses, whether it's dining services, sporting events, obviously classroom instruction. We have people living on our campuses. We have research facilities that we're trying to engage in our research activities, and all sorts of things that make the decision making so incredibly complex. There's so many branches that we have to be considering. For us, the goal has always been, we wanted to stay in the critical parts of our mission, and that is, we want to be teaching our students, and we want to be engaging in the research that's so important. And so we looked at all of the factors coming into this. As the superintendent pointed out, we're dealing with a virus, and it's been unpredictable and can still be unpredictable. And so we have to plan for all contingencies. And for us to reopen and to remain doing in-person instruction as we had been before, we had to make sure that we had plans in place for all those contingencies. And so really our focus has been, let's get a plan in place that incorporates the guidelines that we're getting from the Department of Health, our local departments of health, the CDC, and to ensure that we are ready for students coming back to our campus. What is that going to look like? How are we going to handle that influx? Monitoring those students once they're there, including our staff and our faculty. Are they showing symptoms? How do we do that? Containing any outbreaks if we do have them, and we have to plan for that, obviously. And then finally, the plans have to have something in place that if we do have a large spike that requires us to go back to online instruction, what is that going to look like? How are we going to do that, and what does that transition look like? So we're asking all of our schools to have those plans in place before we open. And that's really where the details start to come up, is in those plans themselves. But that's over the basics. That's the approach that we're taking. That's how we're going to make this happen.
Right. And let's talk about maybe some of the specific benefits of having in-person classes. Are there kind of hopes and dreams and kind of the benefits of meeting in person versus online? And is that the hope for reopening?
Go ahead, Superintendent.
Well, one of the things that we learned in the space of remote learning is that the social and emotional part of school, I think we have underestimated and undervalued. So our students miss their peers, they miss their teachers, the teachers miss their students. It's this whole trifecta of the school as a place, but it's also a culture. And I think our students have really missed that. So there's that benefit. Then the in-person learning benefit in terms of teachers having all their tools around them, being able to be differentiating their instruction based on the things that they have in their classroom. That's very limited when you are on a meeting with students, whether it's one-on-one or in a class, or you're giving them a packet of work, whatever that looks like. So I think we also learned that the in-person learning can be a little bit more robust and the content a little richer. Pacing, our teachers, I think, struggled a little bit with knowing how much to teach. Was it 25 minutes or 6 hours? So getting that all right, where when you are in a controlled environment, you can control a lot of those variables that you can't control in a home setting. So those are the benefits that we've seen face-to-face. And there are some students who really were thriving in a remote learning setting as well. For example, we've had reports from students that they had peers who were really quiet in the classroom in person, but you get them on a Zoom meeting and suddenly they were really participating. So we understand that it may not work for all students, but there are definitely many benefits to face-to-face. That's why we're very focused on a blended model that helps us be a little bit more nimble. For some of our more vulnerable students, or there might be a variety of reasons that students might need to stay home, whether it's in that yellow or low risk phase or even in a normal risk phase. So we're trying to reimagine, not just for COVID, but reimagining what learning might look like for all of those scenarios.
Right, Jeff, did you have something that you wanted to add?
Sure. Well, first, I want to say to the superintendent, especially as a parent of young children, I could probably speak for a lot of parents who say, if we didn't appreciate our school teachers before, we certainly do now, having been put in the role of trying to help our children with their online learning and seeing how much our teachers do for the kids and how much they rely on them and how much attention and energy it takes to be teaching these things. We really are grateful for the work that our K through 12 teachers do. It's just a tremendous amount and probably unheralded, but hopefully this will put the spotlight on what great teachers they are. For us, we've learned quite a bit about this transition. It's difficult because the transition happened so abruptly. And I think that a lot of our faculty felt like that had they had the time to develop their courses with online instruction in mind, that they would have made different choices about how they presented the curriculum and things like that. So I think doing that midstream was very difficult for our faculty. And I have to give a shout out to the faculty who took on the challenge and did really an amazing job of transitioning so quickly, and for our students being so patient during that transition. However, I think that what we have found is there's really a role for both online instruction and in-person instruction. There's some things you just can't replicate online. For example, a lot of our classes have a lab component to them. And those labs are hands-on and they're in small groups oftentimes, and they're such a critical part of the instruction at that level. And replicating those online have proven difficult. Some lectures probably lend themselves to online instruction. But we and heard loud and clear from both faculty and staff and students that they really do enjoy that one-on-one in-person instruction and interaction with the faculty. And so we want to maintain that where we can, which is why we're working so hard on these plans. But also we feel like there was some real success in our transition to online. And we see that a lot of the positive feedback about what students experienced led us to believe that there's probably a role for some hybrid instruction, regardless of what happens in the future with this pandemic or future pandemics. We think that a blended model of online and in-person instruction is probably going to be a permanent fixture in higher education moving forward.
Perfect. Let's turn to some reader questions now. We have a question from Tanya on Facebook for Superintendent Dickson. She is asking about possible opening dates, and she's asking if the school districts could potentially consider a 4-day week of classes with reduced hours in light of the pandemic.
Thank you, Courtney. I've tried to answer a few of those in the chat space, but I think that is on everybody's mind. There's the what will happen and when will it happen. Right now, we're trying to catch up on some unfinished learning for students. Some of that's being done remotely, small group, face-to-face, some one-on-one face-to-face with, of course, safety and hygiene protocols in place at the school. So our districts and charters are trying a variety of things to work on unfinished learning. Transitioning into the fall, our schools are planning on their start dates. Again, we don't know whether that will be remote or blended or face-to-face, but we would continue with the same school calendar that's been adopted for that school. We also know that some are maybe starting August 1st with some small group instruction, one-on-one, just to catch up on some of that unfinished learning. But we're planning on the calendars. Now, the schedules within the day might look a little different if we are in that low-risk phase, and that means maybe block scheduling that's a little different, half days, every other day. So definitely we will see some adjusted schedules for sure.
Perfect. We have another question from Rick on Facebook. This is for both of you. What happens specifically when a teacher, a student, or a staff member tests positive for COVID-19? Is only the infected person quarantined, or do they contact trace and quarantine all of those who could have been exposed on a campus or at a school? Jeff, do you want to start with that one?
Sure. Yeah, and Rick is right on in asking questions in this area. This is one of the areas that's most tricky, is dealing with our classrooms. And with our institutions, they vary widely in terms of what their classroom space looks like and how much there is. We want, as a default, to be able to have classrooms where we have good social distancing of 6 feet. Where that's not possible, then we're asking students to wear masks, and we're taking other precautions like disinfecting the rooms and things like that. But knowing that there is a strong possibility that we're going to have someone who is infected and has been in one of our classrooms, we want to be prepared. So one of the things we're doing is, where we can't have social distancing in place in our classrooms, we're asking the institutions to take roll and to assign seating, so that we know where people are sitting and we know who is there on those days. And then we would use that information in contact tracing, as Rick has pointed out. And the protocol generally is that if you have been exposed to someone who has tested positive, then we would ask those individuals to quarantine who have had that exposure for those 14 days. One of the things that we're making sure we have in all of this, the clarion call has always been flexibility. And so we want to make sure that those who are asked to quarantine or who are experiencing symptoms, and we've asked them not to come to class if they are, that we still have online options for all of our instruction in those classes. And so they'll still be able to participate and continue on with their instruction even if they're asked to quarantine. So that's the approach that we're taking.
I'll just piggyback off of what Jeff said. We're kind of in that same space. It's a little different for college age students, I think, versus our elementary kiddos. For many of them, they might have a situation where they can't immediately go home. And so we're really trying to amp up communication with parents to say, if your kiddos have any symptoms, they need to stay home, first of all. So that's an education piece. I think we've been a system where kids have generally come to school sick. They may be asymptomatic as well. So we have to upgrade our health kits and ordering upgraded thermometers and personal protective gear for those who are interacting with our students who might be ill, having a place to isolate them until somebody can come and get them. So there are a lot of physical aspects of dealing with it, as well as then the contact tracing and mitigating the circumstances at school. Definitely our hygiene will all be amped up on college campuses and our K-12 schools. So that's sort of a universal concept, along with teaching our kiddos to make sure that they're washing their hands and doing all of the things we know to prevent the spread. But that shift in thinking about when you have a kiddo who might have two parents working and they're used to being at school when they're ill, that's something that really has to change, because they'll need to be removed from the school immediately if they're found to be ill, even symptomatic.
Right. We have a follow-up question on that from Jen. She asked if K through 12 schools will adjust their school absence policies to encourage students to stay home, and if students will be able to have more than the normal amount of absences during this time.
Yeah, Jen is spot on. That's one of the first things that we looked at. We actually waived some of that last year. And one of the first things that we did was to come out and really encourage schools to change those incentives for attendance, like perfect attendance. You know, a lot of kids came sick just because absences then had to be made up in order for it not to impact a grade or graduation. So those are the kinds of policies that we started changing last spring, and definitely into the fall, those need to be changed. Just a different way of thinking about it, right? And then again, if we have this blended model where kiddos can learn from home, then they're not incentivized to come to school because they know that there are options for them that are fairly seamless to keep learning at home. So that, yeah, I think I've answered that.
Perfect.
Thank you, Jen. Great question.
Perfect. Yeah. Let's talk about what happens in the case that there is a big outbreak. What kind of factors would go into needing to close a campus? What are you specifically looking for? Jeff, do you want to start on what that would look like for colleges?
Yeah, a lot of this is going to be our partnerships with our local health departments and taking instruction from them about what they're seeing. A couple of big factors, Courtney, that we're going to be monitoring as we make decisions about our campus is disease prevalence. And not only how many people are becoming infected or testing as infected, but more importantly, how many are being hospitalized. And it's really the hospitalization rate that's going to be one of the keys. How much capacity do our hospitals have as we're seeing spikes in numbers? And if we see spikes, but the hospitalization rate remains low, then that will impact the decisions and that we're making about our campuses. So the disease prevalence will be a big one. Another thing that we'll be looking at is what do our resources look like in terms of our testing capabilities and our contact tracing capabilities. If those are to where we want to have them for the fall, then I think we'll be well positioned to handle outbreaks quickly. And I think if we could handle outbreaks quickly and have things in place that allow us to minimize the spread of those through that good contact tracing and quick work, we're hoping that we can just continue to maintain. But if we do see significant outbreaks happening on our campus through those resources, then we have those plans in place to say, okay, we're starting to reach some thresholds, and working with our local health departments and the state health department, are we at a point where we need to just maybe transition back into that online model? That's why having that plan in place beforehand is so important, so we don't get caught flat-footed and we can make that transition quick. And we're prepared to make that transition so that the quality of education remains high.
Perfect. Yeah, same question for you, Superintendent. Is this more of a district by district decision?
We're trying to develop requirements. What is absolutely required? And I know the three big things that people talk about a lot are the wearing of masks. What does it look like in terms of transportation and busing when kids are supposed to be distanced? And what does it look like in classrooms with distancing? And again, that's why we're really leaning into that space of a blended model, so that some students can stay home and still continue their learning very seamlessly, as well as coming face to face. So there are a lot of variables, as Jeff has so adequately explained, that go into all of that. We're not working in isolation. All of our local health departments, there are 13 who have been working directly with schools and districts to try and figure a lot of this out. They've started with hygiene, but really talking about these other places as well. So you've seen the guidance in Utah Leads, but we're trying to drill down and give some very specific guidance, because I think that's what everyone wants to know and needs to know. What is required? And then given our context, because Manila High School looks very different than Granger High School, Antimony Elementary looks very different than Cottonwood Elementary. So given all the variables in your community and the level of risk in your community, there has to be some local decision making. And we have to know what works for teachers. I think it was Donald who was talking about the teachers. A lot of our teachers are very concerned about coming back. And so we have to think about those who work in food services, our bus drivers, our teachers who have all leaned in and just been amazing. All of the paraprofessionals in our schools, playground aides, all of these adults that are exposed to our kiddos who tend to be little vectors of the disease and could be asymptomatic or symptomatic. But what does that mean for all of the adults? Many of our workforce might be in that at-risk category. So we have to take measures for them as well. And that's campus by campus, depending on space and the things that they have at hand. So there's just a lot of moving parts that we have to think about to keep our staffs, the adults in the building, safe and our kiddos safe.
Perfect. That jumps right into our next question. Alicia wants to know if high-risk students will be able to do remote learning if they choose to. So vulnerable students, and let's add to that, will staff be able to work from home if maybe they're at high risk for the virus? Do you want to start with that again, Superintendent?
Sure. Yeah, and I addressed that a little bit, but yes, this blended model is part remote and part face-to-face. So if you're an adult in the system or a student, that you could still work in that home space. And again, taking into consideration all the variables for the family, the teacher, the kiddo. So let's look at that in the context of a rural setting. You might have one teacher in a rural high school who teaches 4 or 5 different preparations. And if that teacher is high risk, then who teaches those courses? So we're working right now on thinking about how somebody in another rural district could step in and do some face-to-face, but also some broadcasting, so that everybody has, sorry, that's Big Ben in my background, so that everybody has an opportunity to learn either remotely or face-to-face, but crossing boundaries of districts, so that teachers in rural areas, district to district, are sharing those experiences and working together. So think about all the creativity that's coupled with the complexity to make this work in a K-12 setting.
Perfect. Yeah, Jeff, do you want to talk a little bit about that as well?
Yeah, the superintendent's exactly right. One of the complicating factors about this is we not only have to figure out a way to address high-risk students, but also to accommodate our faculty and staff who may be high risk. And so we're taking the same approach. Again, it's coming back to that word flexibility. And we want to work closely with students and with faculty and staff who come to us and say, look, I'm high risk for the following reasons, and I'm concerned, but I still want to teach, or I still want to work, or I still want to attend classes. And so why that hybrid model is so important. And so we will have those options, whether it's for a faculty member who is high risk and can't come in but wants to teach. Well, we're going to have plenty of online instruction, and we will figure out a way to make sure that they have the opportunity to teach online. And those who then maybe become sick during the semester, that we have the ability to switch as needed. And the same thing for students. We want to make sure, first and foremost, that our students have access to the education. And so making sure that we have as many options as possible for our students to be able to do this and do it safely is the most important thing that we're looking at.
Great. And let's specifically address college campuses. I think you described them earlier as little cities, which they are in a lot of cases. You have a lot of unique circumstances. You know, you have dorms there, you have students kind of everywhere, in libraries, staying late hours. Talk to me maybe about some of the unique challenges with having students live on campus and being there for such long hours.
Yeah, thank you, Courtney. That's a great question. And it's actually interesting because we were having a conversation the other day about this, and it's almost antithetical. But really, we feel like the bigger risk is not with our students who are living on campus. It's the students who come to campus every day and then leave and go back to where they live or to their homes with their parents or whatever, that they are likely having more exposure to or potential transmission of the virus and then bringing it back to campus the very next day than we would with our students who are living on our campus and, you know, are using our dining services on the campus, and that we're able to maybe monitor that a little bit better than we are those who are commuting in. And so it does present a unique challenge, but at the same time, having people living does give us some real possibilities of having a strong spike in transmission if we're not careful about how we operate those. And so one of the things that we're doing in our online or our on-campus housing is we're making sure that we have isolation and quarantine facilities available to our students, so that if they are living in a residential housing and they do test positive, that we have a place then they can go stay, that they can be isolated and quarantined away from the rest of the on-campus housing that they're living in. And that way we can try to mitigate the spread of that and also engage in our contact tracing. Another thing too is that, you know, we have these common areas in our dorm rooms, or dorms generally. Those are things that we're going to have to monitor. We're going to have to clean those often. And again, the contact tracing will be really important. But those are some of the things that we're doing with our residential. A lot of what we do on our campuses resembles what you would see just in normal businesses, whether it's having our food courts, we have bookstores and things like that. Those are going to be following the same protocols that other businesses would follow. where possible. And then the workers that work in those will have the same protocols about wearing masks and having access to PPE and doing symptom checks and monitoring and things like that. So we look at those kind of things as well. Of course, we're looking at the real challenge that we face with some of our closed quarter educational experiences, in particular research and the research in labs and things like that. So our schools oftentimes are taking extra steps to ensure that those working in research facilities have additional steps that they need to take to ensure their safety. Another thing that we've been discussing, and I know that the University of Utah is taking some steps, is just looking at the calendar. There are some creative ways that we can look at what happens when all of our students leave for the Thanksgiving break. And can we do it such a way where we don't have them come back to campus after they've left for that break? And so looking at maybe eliminating the fall break in October and having that week have normal instruction. And then after Thanksgiving, after everyone's gone home, that the campus remains just online for the next couple of weeks, and that those finals start that second week of December. Just another way to creatively look at the risk factors, because the real risk is when you leave campus, potentially get exposed to the virus elsewhere and then come back. And so all of those things are open right now and part of the discussions that we're looking at that are sort of unique to some of the challenges in higher education.
Perfect. Yeah, let's talk a little bit more too about sanitation and what that's going to look like to kind of reduce the spread of this. Jason on Facebook wants to know specifically if schools are going to be testing students for COVID-19, but I'm kind of curious too, as far as reducing the spread, how we're going to keep things clean, if there's going to be, hand sanitizer stations. Superintendent, what does that look like for K through 12 schools?
Yes, Courtney, this is the place where we've really been working with our health departments early on, even back in the spring, anticipating coming back. As you know, the pipelines to order a lot of these things has been tricky. So we've been working with state purchasing and others to just try and get some supplies into the schools that we haven't had. We started with thermometers and PPE and wipes. The hand sanitizer stations are the hardest thing to come by. So we're starting right now with basically these bags, if you will, of hand sanitizer and pump bottles. And we need to keep those in controlled areas, not just out in hallways, but as you enter the office and in all of the classrooms. We know that some of our classrooms may not have sinks for hand washing, so hand sanitizer is not just a substitute, but in some cases might be the only opportunity in a classroom. So we'll continue to monitor and try to get all of those things in place, but the hand sanitizing stations are a challenge. I know that Jason also mentioned testing. We have been working with some in the COVID space who are trying to set aside tests for the adults in the system. We can talk about students down the road, but we also want to make sure all the adults who are coming back have those available. And then testing students, that gets into some privacy and family issues as well. So we see testing as a family-centered issue right now, but certainly that's something that if we have a case in a school or we know of a student who has been impacted, we have to engage in that contact tracing and then make sure that we have tests available. So some have been set aside for the adults in our system.
Perfect. And yeah, Jeff, what does testing and sanitation look like on college campuses?
Yeah, not too much different than what the superintendent has described. We are scrambling like everyone else to buy up as much hand sanitizer and disinfecting wipes and masks as possible. All of our schools are recommending our students wear masks, and that's the expectation in the classroom or in situations where social distancing isn't possible. We still feel like the very best thing everyone can do are to following those basic protocols. Wear a mask in public. Wash your hands often, use hand sanitizer, sanitize the high touch areas as much as possible and as often as possible. And that by doing those things and everyone really working together and encouraging each other to do those, that we can have a real impact on prevalence of the virus. And the testing is a tricky thing, making sure that we have enough testing, but the question of who are we testing, only symptomatic, or do we look at asymptomatic? And that's we're still working through that with our Department of Health and the local departments of health and the University of Utah and the hospitals there. They have been tremendous in helping us work through that and what those protocols will look like, and how many tests will even be available and how we'll use those. We're still figuring those details out, but testing will be a large part of how we manage this and remain open for the fall and spring.
Perfect. Well, we are about out of time, but I want to end on one last question, and it may be the hardest one yet. I'd like to know from both of you what's kind of the one thing that parents should know, both for college students and for K-12 students. So, Jeff, we'll throw it to you first. What should parents know?
I think that parents, students should know that in every conversation that we have had, as we've hunkered down in meeting after meeting and with just so many different people in all of the areas, that the very first concern that we have is the health and safety of the students and the faculty and the staff. And that we really can't fulfill the mission of our institutions to teach and to research without our faculty, staff, and students being able to feel like they can come, and that we're taking all reasonable steps possible to make this place safe for you, but also that we understand everybody's coming from different circumstances and that they have different concerns. And that's why we will try to work with everyone in every circumstance to give you access to your higher education needs. And that's the same for our faculty and staff, that we want to work with you, and that we'll be working furiously to just try and make sure we have options available to meet all of those different needs from all those different people.
Perfect. Yeah, Superintendent, what are your thoughts on what parents should know?
Completely echo what Mr. Landward just said, and that's really our primary concern, is the safety of all in our schools. I think we have to get into this space of thinking about a nimble system, and that as we return back to fall, things will look different. And while all want to hope and work towards normal, I'm not sure that we'll ever be back to normal, because there will be different protocols and procedures in place. And that's a good thing. And we'll have blended models where it's more personalized for the situation of the community and the school. But what parents need to know and be prepared for is this nimbleness of the system, so that at any given time, they might find their student back in a remote setting. And that places a burden on our childcare centers and a lot of things that we have to think about. So this is not something just for one family or one student. It's a community issue, and all communities are really trying to work together to think about the best health and safety, what works for families and what doesn't work. And we have to not forget that whether we're at the physical building or at home, that broadband and all of those services, that is a principle of equity. So until we can make sure that everybody has the resources at home and at school that they need, that we will continue to have a lot of disparity gaps within our communities, whether that's on a college campus or in our K-12 system. We really have to stop and think about what are the resources and tools that every family and every student needs in order to do their best work in these challenging times.
Perfect. Those both sound great. Well, I can't thank you both enough for taking the time to be here and talk to us.
Yeah, it was a pleasure. Thank you, Courtney.
Thank you. Bye.
Thanks to the listeners for the good questions.